Welcome back to episode 3 of the Anterior Pelvic Tilt Rehab series. Sedentary lifestyle, including a lot of sitting, can lead to anterior pelvic tilt. And when your pelvis is in this excessive tilt, it can actually lead to lower back pain. But luckily, we have a solution. A stronger core can actually counteract the force that's pulling your pelvis into this anterior tilt, and instead pull your pelvis back into a more optimal position. Today we're going to show you 2 exercises to strengthen your abdominal muscle. These exercises are designed to target people with anterior pelvic tilt. Welcome back, I'm Fred, advancing health education so that all people can live a functional and quality life. Sitting for long periods of time can actually promote overactivation of the hip flexors. And when your hip flexors are overactivated, you can actually put your pelvis downward into this anterior pelvic tilt. And when your pelvis is in this end of range position, it can actually cause increased curvature at your lumbar spine. And biomechanically, there will be increased stress acting on your back. And over time, people can develop lower back pain. To fix this, we need to get your abdominal muscle to be much stronger so it can actually counteract this downward motion and instead pull your pelvis back into a more optimal position. So how can we assess for weakness of the abdominal muscle? To do this, we can perform the lower abdominal strength test. You're going to move your hip to 90 degrees. Then posterior tilt your pelvis by contracting your abdominal muscle. Now slowly move your leg downward while maintaining a flat back position. If you're able to maintain this position throughout the test, then this indicates that your lower abdominal muscle are very strong. But if you notice your lower back coming off the ground, then it's a sign that you need to do some work to get your abdominal muscle to be much stronger. Now I'm going to show you 2 exercises to strengthen your abdominal muscle. Doing this can also move your pelvis into a more optimal position, and most importantly, fix your lower back pain. For the first exercise, you're going to move onto your knees, then posterior tilt your pelvis by contracting your abdominal muscle. This component is really important as it serves as a foundation for today's exercise. If you do have any questions on how to do this correctly, please see our previous video. Now maintain this pelvis position, then move into a plank position. It's really important that you start this exercise at a low intensity. For example, holding the plank position for 15 seconds but more repetitions. Because the last thing we want to see is for you to get tired and start doing this exercise where your pelvis is in this anterior pelvic tilt. For the next exercise, you're going to very slightly push your heel downward. By doing this, it can activate your hip extensors, which ensures that your hip flexors are fully relaxed while you're performing this exercise. As mentioned in our previous video, overactivation of the hip flexors can cause anterior pelvic tilt. Now you're going to posterior tilt your pelvis by contracting your abdominal muscle. Maintain this position, then move your body forward until your shoulder blade comes off the ground. Now slowly coming back. So there you have it, 2 exercises to get your abdominal muscle to be much stronger. If you follow today's program, it will help position your pelvis into a more optimal position, and most importantly, fix your lower back pain. If you want to learn more about lower back rehab and ways to improve your overall health, then make sure to smash the subscribe button. Thank you for watching. We will see you next time.